We are starting to see people's free at-home COVID tests arrive in mailboxes. And these are the tests you can get through the federal government after the last surge caused demand to skyrocket. But with so many people now able to test at home, how will it affect efforts to track cases in Georgia? Our Joe Hankey spoke one-on-one with the CDC director about it. Joe?
Well, and Sheba, those at-home test kits make it very easy to see if you're positive from your house, of course. But today I asked CDC Director Rochelle Walensky if they're impacting how we're able to track the pandemic, as results are rarely, if ever, reported, unlike PCR tests.
We should know that there are about 1.4 million PCR tests still today being done in this country. We're watching and monitoring that carefully and watching from our surveillance standpoint the use of PCR tests.
Even with the rapidly growing popularity of at-home COVID-19 tests, Dr. Rochelle Walensky says there's still a significant amount of Americans daily seeking out PCR tests, the results of which states, including Georgia, do record to track as best as possible the spread of COVID-19. The use of such tests in Georgia is declining, though. When Omicron was first detected in Georgia, more than 36,000 people per day took a PCR test. That drastically increased to more than 67,000 tests on average per day by mid-January. But with the holidays behind us and with at-home test kits appearing again on store shelves and now being mailed from the federal government, PCR test usage is down 32%. While that could impact surveillance of the virus, Walensky says at-home tests are still a valuable tool because it provides a convenient testing option, but it comes with responsibility.
The use case for at-home tests is really different. It's empowering you to make decisions about how you behave, who you interact with based on the results of your at-home test. So we're encouraging their use. We want you to use them. We want you to take caution and use them appropriately. If you're positive, of course, stay home. If you have symptoms, if you're negative, then of course go and get a PCR test. But we're continuing to do that surveillance through PCR.
And Walensky says the CDC also uses hospitalization numbers and other non-testing data to fully track the virus. And as Governor Brian Kemp says, he's now moving forward with legislation to give parents the right to decide whether students must wear masks at school. Dr. Walensky told me the CDC continues to recommend the use of masks in school as one of the best options, along with vaccinations, to protect students and staff.